All right, I'm doing a cardiac pulmonary assessment. I'm gonna start with the pulmonary assessment. I got the stethoscope, my watch. Okay. All right, ready?
Yep.
Knock knock.
Come in.
All right. Hey.
Hey.
I'm gonna shut the door for privacy.
Thank you.
I'm Heidi. I'll be your student nurse today. I'm gonna wash my hands.
Okay.
Can you tell me your name and date of birth, please?
Bryce Howell, August 26, 2000.
Okay, great. I'm gonna put on some gloves. Do you have any allergies I need to be aware of?
Just penicillin.
Okay, can you tell me what happens when you have it?
I just itch.
Okay. Do you have any cultural or religious preferences?
No.
Okay, are you comfortable where you are?
Yes.
Okay. All right, so today we're going to be doing pulmonary assessment as per the doctor.
Okay.
So I'll be feeling, palpating, and listening to your chest and lung sounds, okay?
Okay.
Is that okay?
That's fine.
All right. If at any time you feel uncomfortable, just let me know, okay?
Okay.
All right, so first I'm going to take a couple vitals. Is that okay?
That's fine.
Okay, I'm going to take your heart rate real quick. Okay, so your respirations were about 14. Let's take a family history as well, okay?
Okay.
Do you have any shortness of breath?
No.
Respiratory problems at all?
No.
History of smoking?
Mm-mm.
Do you have a productive or non-productive cough? No? Okay, all right. All right. Your respiratory rhythm and depth seemed pretty normal, and your chest is pretty symmetrical as well, okay?
Okay.
All right, so now I'm going to inspect your chest, the front and the back, to see if you have any issues. Yes.
Okay.
Okay, let me just look real quick. Okay, I'm going to check your costal angle.
Okay.
Okay. It seems perfectly at 90 degrees.
Okay.
Let me check your back. Okay. Can you bend just a little bit for me? All right. All right, you can sit back. All right, your spinal column doesn't seem to be deviating, so it doesn't look like you have scoliosis, so you're good.
Okay.
Next I'm gonna check your throat, your
Okay.
trachea, just to see if you have any issues. No, trachea doesn't deviate. We're good with that. All right, next I'm gonna palpate your chest with my palm, okay? I'm gonna
Okay.
check for any tenderness or masses or any crepitus, okay?
Okay.
All right. Okay. Take a couple deep breaths for me. All right, and now I'm gonna palpate your back, okay?
Okay.
All right, take a deep breath for me. All right, take another one. Good. And just a couple more. All right, so everything seems normal. You can get back in a comfortable position.
Okay.
Okay. Now I'm gonna, can you turn back around for me? Sorry,
Yes.
I'm gonna
Yep.
check to see if you have good expansion, okay?
Okay.
Let me put my thumbs at the 8th and 10th intercostals. All right, take a big deep breath for me. Good, good. All right, your lungs expand really well as well.
Okay.
All right, I'm gonna check. I just need you to say a sentence for me if you could.
My name is Bryce Howell, and I'm a nursing student at UWF. Hello.
Alright. Good vibrations, tactile fremitus is very noticeable.
Okay.
Now I'm gonna percuss your chest, which means I'm gonna put my palm on it and hit it to see if I can feel anything.
Okay.
Alright. It's also going to tell me if you have any fluid, if it's going to make the noise. Sorry. Okay. Alright, turn back around for me. Alright, no sounds of fluid in the lungs or any mass. Alright. So everything's going pretty well. Next I'm going to listen for any abnormal lung sounds if it all sounds normal. I'm going to use the diaphragm. Let me wash it real quick with an alcohol pad.
Okay.
Alright. Alright. Take a couple breaths for me. Now your backside. Take a deep breath. Alright. All sounds good. Your bronchiovesicular, and vesicular breath sounds all sound normal. You didn't show any signs of crackles, wheezing, or rales. Stridor, friction rub, nothing.
Okay.
Does everything seem okay right now?
Mm-hmm.
Alright, you comfortable?
Yes.
Alright, will you lay down for me? Yes. Alright, so next I'm going to do your cardiovascular assessment. I'm going to ask you a couple history questions. Do you get fatigued easily?
No.
Are you independent or do you use assistance at home?
Independent.
Okay, do you have trouble being independent?
No, not at all.
Okay, do you have a history of high blood pressure?
Nope.
Strokes?
Nope.
Any heart conditions?
No.
Do you get chest pain?
No.
Do you get short of breath?
No.
Do you have any dizziness when you move?
No.
Alright, are you on any heart medications?
Mm-hmm.
Alright, good. So next I'm going to inspect your neck, your carotid, and jugular veins just to check your pulsations. Okay. Your jugulars are about scoring a 1. They're kind of visible. Pretty good. Okay. So I'm going to palpate your carotid arteries, okay?
Okay.
Yeah. They're very strong. Okay. All right, next I'm going to listen to all of your heart sounds, okay?
Okay.
I will use the bell at all locations if any questionable sounds are detected to detect low frequencies, such as a murmur. All right, so I'm going to just check over the precordium, which is right over the chest. It's the chest wall. S1 and S2. Lub-dub, the start of systole and the end of systole. Yep. All right. Next, I'm going to listen at the second intercostal on the right side, which is right there. This is the aortic valve. Good. Now moving over to the left side. This is the pulmonic valve. Moving down to the third intercostal, the second pulmonic. Then the fourth. This is a tricuspid. Getting stronger as I move. And then the fifth is the apical pulse. I'm going to listen to this one for 1 minute. All right, great. All right. Your heart rate sounds pretty good. All your beats, pretty good. All right, next I'm going to check your periphery, which is just your extremities for color.